Begay. He was very professional, would always support us, would always greet us with respect. Yes, he was a true leader. He gave us support when he came to see us several times, or when we met with him with Hess committee. And he spoke up for us, encouraging us to do quality work, quality job, running the self-governance and under Title V. So we will truly miss him, but his legacy will carry on, and we will cherish those as it was mentioned. With our deepest condolences to the family, with our Bahatis Dishiyaj. Adoshin Hajo Shitahatil, Kodo Winslow Indian Healthcare Center, Dal Nishi, Dash Nishi, the Nan Bahanet Tahono, the Azel any Gashike, Adatik Ihage 2020 AD, Hot Eda at the Hot, Ishi Bashit Neto. I want to thank you.
Hello? Can you hear?
Oh.
This is Velma from Board of Director with the Winslow Indian Healthcare Center, representing Tulani Lake Chapter. Good morning.
Oh, good morning.
Cordia.
Okay. Anybody else? Okay, thank you for all the folks that are on the line. We appreciate your attendance. Ms. Spencer, did you review the agenda with the committee?
Okay, thank you, Mr. So. Agenda for Health, Education, Human Services Committee, 24th Navajo Nation Council, special meeting April 15, 2021. 8 a.m. presiding Honorable Daniel Eso, Chairperson, Honorable Carl Russell Slater, Vice Chairperson. Through telecommunication, 1, call meeting to order, roll call, invocation, and announcement. Number 2, recognize guests and visiting officials. Number 3, review and adopt the agenda. Number 4, review and adopt the journal. There's none. 5, receiving report A, report Winslow Indian Healthcare Center FY 2020 annual report. Presenters Winslow Indian Healthcare Center staff. 6, old business, none. 7, new business, there's none. 8, close of meeting announcement and adjournment. Mr. Chair. Thank you.
Thank you, Ms. Spencer. Committee members, what's the wishes of the committee?
Mr. Chair, this is Virgil Davis of Winslow. We'd also requested yesterday to also add our 2020 financial audit in it as an agenda item along with the annual report for 2020.
Okay, we'll just include that as part of the annual report. Mr. Davis.
Motion, Delegate Paul Begay to accept agenda.
Thank you, Mr. Che. Honorable Paul Begay motions to adopt the agenda.
Second.
Second. I'll recognize Honorable Edison Winika to be the second on the motion. Honorable Slater, he's right in front of me, and so he basically got the tab. Yesterday, committee members, I asked that we include a report from Dr. Elvira Bitsui, as well as Mr. Tom Platero, regarding the submittal by Department of Head Start to which we had a big dollar amount for Head Start centers. And I wanted to have a more valid what would you say, estimation on that request. Then the other was, and then this morning I'd like to ask the committee to add an update on the Inez office space that was occupied by the staff of the office of the OSEERS, Office of Special Education Rehabilitation Services. So those items, committee members. Honorable Paul Begay, Honorable Edison Juanica.
Thank you, Chair. This is Delegate Paul Begay. I will agree and concur with the addition of under receiving reports, Dr. Elvira Bitsui and Mr. Tom Platero, and also receive an update from the Inez office space, which you have recommended we have a report from the update. Thank you.
Thank you. Thank you. And Honorable Juanica concurs. Excuse me. Not Inez. Ayana Nez is the proper term. Okay. Committee members. Ms. Nota, roll call vote on the amended agenda.
Okay, Honorable Paul Begay Jr., how do you vote?
Delegate Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Carl Russell Slater.
Delegate Slater, green.
Honorable Russell Slater votes green. Honorable Pernell Halona. Honorable Charlene Stokes.
I vote green.
Honorable Charlene So votes green. Honorable Edison J. Juanica.
Green.
Honorable Edison J. Juanica votes green. Honorable Pernell Halona. Honorable Pernell Halona. Chair, you have 4 in favor, 0 opposed, 2 not voting, which is including Honorable Chair Daniel So not voting and Honorable Pernell Halona not voting. Honorable So.
Okay. Thank you, Ms. Nota. So with that, we adopt the amended agenda. We'll go to item 4, review and adopt the journals. There being none. And we'll go to item 5, receiving report. A, Winslow Indian Healthcare Center FY 2020 Annual Report and Audit Report. Presenters would be the staff of Winslow Indian Healthcare Center. With that, Shanella, Miss Sally Pete, thank you for taking time from your precious day off. And we are honored that you would do that to come meet with the support your staff as they present the annual report and audit report. Thank you. Who would go first? Winslow Indian Healthcare Center staff.
That may have been Mr. Chair Danielson and SC committee members. Virgil Davis, as I said, of the Chief Operating Officer, as well as the Acting CEO for Ms. As we on behalf of the Winslow Indian Healthcare Center, we'd also like to send our condolences for the passing of Honorable Nelson Begay on behalf of the board, the management team, and staff. So I'd just like to just offer that as an opening statement. Of the annual report that you see before you, basically was on 2020 fiscal year. And it was, and as we all know, 2020 was an unprecedented year for the nation as well as the Navajo Nation. And it challenged our healthcare systems for 638, for the urban, as well as for the Indian Health Service. So we all worked as a team. So our annual report, as well as our financial audit report, basically showcased our leadership, our resiliency, our consistency, and our commitment to enable us to move forward in providing the best of healthcare during this unprecedented time. Our annual report and financial audit also showcase our accomplishments that have been carried out by the hard work by our WIC staff, our management team, and the support from the board of directors. We also extend a respectful appreciation to our Natani, as well as members of the HES committee, for providing WIC support and guidance in our common goal of improving healthcare for our patients, our relatives, as well as our communities for the southwest portion of the Navajo Nation. The annual report and the financial audit is our storyboard, if you will, of the COVID pandemic that has occurred during 2020, as well as currently happening now. This has enabled us and given us incredible opportunity to address lessons learned in a very strategic and forward-thinking way. So that is what we wanted to present today. I'll have Mr. Captain Peter LaLuke synopsize the annual report, as I'm sure that you've already read the report, annual report. So I'll go ahead and yield this over to Captain Peter LaLuke. Thank you.
Yate Bene, good morning. So the majority of our activities was really to help address the pandemic. That being said, we still continued some of our regular services. Some of the things I just wanted to highlight is, it's a testament to WIC leadership, our medical staff and our support staff. Even during the first peak of the pandemic, we still continued our regular services in some kind of capacity, including things like optometry, dental. Now, even though, it was in a limited capacity, we'd see like emergency visits, but we still tried to continue regular services while still meeting the needs of patients during the pandemic. So one of the things that we did, actually, let me scroll through this, we can always come back to that, is in an effort to actually make sure that we can see patients in an expedited manner, we rearranged our services to actually have a curbside clinic, and we also had a respiratory clinic. So in this way, we were able to have patients present to the clinic and actually prevent any kind of delay in care, but also help triage patients and screen patients So that way, if they were exhibiting respiratory symptoms, we could actually see them right away, but also help prevent them from spreading the disease to other patients. So we had a significant amount of patients that would actually come through the respiratory clinic. We also had quite a few patients coming through for the curbside clinic as well. And again, this is in addition to us having all our other services in some kind of capacity. Again, with the pandemic, it kind of limited as far as what patients we could see, but we did see patients on an emergency basis for optometry, dental, and even our specialty services were doing televisits as well. With the pandemic, a lot changed over the course of the pandemic. I mean, everything from when it first presented in March of 2020, we initially did mass testings to help prevent the spread of the pandemic. We also made sure that we emphasized flu vaccinations because we also wanted to mitigate any kind of concurrent diseases, so flu with COVID, just because there was an increased risk of complications with those two. So we had a significant push to get flu vaccinations done in advance, essentially doubling how many patients we're able to administer flu vaccinations to. And not only doing that out of our main site, but actually doing multiple mass vaccination clinics throughout the southwest portion of the Navajo Nation. So we also conducted quite a bit of COVID testing and actually went out to, again, different sites throughout the southwest portion of the Navajo Nation. Again, in an effort to help kind of mitigate the spread of COVID-19. And this, we actually had participation from everyone from medical staff. This was coordinated and organized by community health and even the support staff, as far as being adaptable and accommodating these mass vaccination clinics. So one of the things that that Winslow Indian Healthcare Center has always prided itself is, we treat patients as a whole. We do more than just treat the patient's medical needs and direct clinical care. And community health was participating in quite a few activities, everything from delivery of water, but also firewood, food distributions. They did some significant outreach throughout the chapters that we serve, as far as with Winslow Indian Healthcare Center, doing quite a few wood deliveries. They also were the ones that essentially spearheaded case management and contact tracing. So they actually used the software system that's been used by a lot of sites on Navajo area ComCare. It also has the data shared with the Navajo Nation Department of Health. But they followed a significant amount of positive cases, but they also did the contact tracing and did an excellent job as far as contacting people on a regular basis, help supporting them in any way that they needed. They also work closely with the Navajo Nation CHRs as far as if patients needed cleaning supplies or food or any kind of other support, and also directing patients what to do if symptoms seem to progress. But the other thing they did is they also reached out to any contacts, let them know, what to look for, how to quarantine, how to isolate, and they followed a significant amount of patients, especially once we got to the second wave. But that's the synopsis, I guess, of the efforts that we did for the pandemic. And that being said, we also continued other projects as much as we could. 2020 was originally scheduled to be one of our site surveys with our accreditation. So we were preparing for that. We've continued to do our patient experience surveys. Even with the limitation as far as seeing patients for direct services, again, we continued them in some kind of capacity. So it was actually nice to see that even though things kind of dropped a little bit regarding the provider patient communication, it was still maintained to some kind of capacity. When we use our patient survey, we actually compare it to national results, and even the national results were prior to the pandemic. So we were actually doing fairly well. Now, one of the things is we use the GIPRA clinical measures, which is similar to a lot of the IHS facilities throughout the Navajo area. Now, again, unfortunately, 2020, due to the the breakdown as far as care and refocusing our resources to address the pandemic, it was a challenge to meet some of these benchmarks. But that being said, you can see here, we are still able to maintain and meet some of these national benchmarks, even when compared to the rest of the Navajo area. And again, I think this is a testament to how hard the medical staff worked to not only meet the needs of the pandemic, but also make sure that we didn't get COVID tunnel vision and still address the routine care that patients needed as well. So some of the other projects that we also did, this one, at the beginning of the pandemic, a lot of things were changing recommendations. We had to deal with PPE shortages, but always a concern was the issue of patients congregating in areas potentially spreading COVID-19. And even though we had the curbside clinic, developed and also the respiratory clinic, we still found that patients were trying to receive routine care and being seen for their appointments were actually still in waiting areas. So through WIC leadership, incident command, and med staff and support staff, a software system was actually implemented where patients could actually notify the facility when they were present on campus, which was communicated to our patient access. We would also communicate with the clinical staff. And so patients didn't have to wait in these areas, potentially becoming in contact with other patients with COVID. Again, one of the biggest things, especially at the beginning of this, is quite a few patients were asymptomatic. So despite screening processes and implementing all that, there still could be patients that had COVID that just didn't realize it. So with this software, you can see we were able to dramatically decrease the patients in the waiting area. And what would happen is when the clinical staff were ready to see the patient, they could communicate with them and have them come directly into the clinic and go straight to the screening area and to the clinic rooms. So that also helped prevent overcrowding. Eventually, this was actually submitted to our accrediting body, AAAHC, and we received national acknowledgement as far as using this software. One of the other things with this we were working on prior to the pandemic really hitting our area is doing a self-assessment to see about getting accredited with public health accreditation. So this was actually with a grant with NAHB. This was a lot of work with community health that put this together. But since we actually addressed a lot of the public health needs for the southwest portion of the Navajo Nation, we were looking to getting this accreditation. This would also help us meet, nationally recognized standards, but also ensure that we were ensuring that we were doing quality public health work. So, and actually a lot of the stuff that was assessed prior to the pandemic, it really kind of came into play as far as working with outside entities, including the Navajo Nation Department of Health. But this is something that we're going to continue to pursue. And again, it's made very apparent that this is something that we need to work on as far as working with all different external entities as far as addressing public health needs. Some of the other things, our lab also goes through national accreditation. So FY 2020, so right before the pandemic, really started to be present in the US, they achieved their accreditation. The other thing is for our diabetes program, they actually became a certified diabetes self-management education program, which this was a lot of work. And actually it's something that we've always tried to do. And so it was amazing that they were able to accomplish this and continue to maintain it. So they did renew this relatively recently and still was able to meet the standards and the requirements to maintain this certification, even with the pandemic going on. But essentially, those are the activities, or at least a highlight of the activities that we did throughout 2020. Again, we were trying to balance the routine needs of patients while also meeting the needs of the pandemic. There was a lot of changes, a lot of flexibility and adaptation as far as in 2020, especially with the constantly changing recommendations. But I think it's a testament, again, to WIC leadership, our incident command team, and WIC staff that we were able to accomplish all of this with the challenges faced with the pandemic.
Mr. Chair, this is Virgil Davis and committee members. Are there any questions you'd like to ask our team with regards to the report? Mr. Chair, can you hear us? Are we connected? Are we still on?
Yes, you're still connected. I think we have some connection issues.
This is Vice Chair Slater. I would continue with the presentation for now.
Go ahead. Vice Chair Slater, I'm unable to hear Chair Daniel So. Would you allow us to also present our FY 2020 financial audit report? Or did you want to take, if you have any questions for the annual report?
I don't have any questions at this time, and in the absence of their connectivity while they're reconnecting, I would continue with the audit report or financial report.
Okay. Karen, can you go ahead and introduce Mr. Trujillo?
Good morning, committee members and leadership team, management and board of directors. My name is Karen Loop again. I'm the Chief Financial Officer at Winslow Indian Healthcare Center. We have our auditor, our financial auditor on the call today, and his name is Joshua Trujillo, CPA with SJT Group of Albuquerque. So it's been a pleasure working with our new auditor this fiscal year. Winslow has been in compliance with most of the auditing and accounting standards, and I think it's really a reflection of the work that we do here at Winslow Indian Healthcare Center in providing quality and accessible patient care. And it's been a pleasure working for the organization and to ensure that we do well financially, to ensure that we do have funds to address health needs in our community. So we're all connected in that way, and I appreciate this opportunity. So I'll give the floor to Mr. Trujillo to present the FY20 financial audit. Thank you.
Thank you, Karen, and good morning, members of the HES Committee, Board of Directors of Winslow, and management team members of Winslow Indian Healthcare Center. Thank you for inviting me to present the results of the fiscal year 2020 audit for the Winslow Indian Healthcare Center. As Karen mentioned, this is the first year that we've been engaged to perform the audit for Winslow. And what I put together for the presentation today was just a small PowerPoint presentation that'll walk you all through the audit information for fiscal year 2020. So Winslow's fiscal year ends on September 30th each year. So the information we're presenting is for the year October 2019 through September 2020. And really, the first couple of slides just have our main responsibility as auditors and our audit results. And really what we're engaged to do is provide an opinion in a few areas. We provide an opinion about whether the financial statements of Winslow are materially correct. And we also provide an opinion about whether the about whether Winslow complied with these direct and material compliance requirements that affect their federal award programs. Now, in both of these areas, we provide reasonable but not absolute assurance. We don't audit every single transaction that flows through the accounting system or that affects the bank statement. And we don't audit every single federal award program that is administered by Winslow. But in areas where there's a lot of activity, we may pick samples of activity. We may perform other types of analysis to be able to provide that reasonable assurance. And then in both of those areas, we also obtain an understanding of your internal controls to help us plan the audit, but we don't provide an opinion on your internal controls. But what we do is if we identify weaknesses in Winslow's internal controls, we communicate that to Winslow's management as well as the board of directors. Now, with that being said, I mentioned, the 3 phases of the audit, and they're really detailed here on this slide. One of our responsibilities is to provide an opinion on the financial statements, and that opinion is an unmodified opinion. It's really the highest level of assurance that we can provide as auditors. The second part of the audit is to provide an opinion on whether Winslow's major federal award programs complied with these compliance requirements. And we also issued an unmodified opinion in that area of the audit. We did audit 2 federal award programs that were operated by Winslow during fiscal year 2020. And I'm happy to report that there were no material weaknesses identified and no significant deficiencies in internal controls reported as part of the federal award program compliance audit. And then on internal controls over financial reporting, we did identify one material weakness, which really related to the accounting for construction retainage related to the Dilcon Medical Center construction project. And that was a new a weakness identified for the fiscal year 2020 audit. We discussed that at length with Winslow management, and it appears that this is already being corrected for fiscal year 2021. Aside from that, we didn't have any other significant deficiencies to report as part of the audit. These are the 2 federal programs that we audited as part of the audit. Obviously, Winslow's largest grant program is its self-governance grant under Title V. And for fiscal year 2020, the federal awards expended under this grant were just under or just over $73 million. Now that's made up of expenditures both under its regular annual funding agreement, as well as money spent under its COVID-19 funding, as well as amounts that were incurred for the Dilcon Medical Center construction. All of those are funded under the annual funding agreement, just under different funding streams. And that entire program was audited by us as part of the fiscal year 2020 audit. Winslow also received special monies for COVID-19 activities with expenditures just over $595,000. And that program was also audited as a major program in fiscal year 2020. And like I said, we issued an unmodified or a clean opinion on Winslow's compliance with the direct and material compliance requirements that affect these programs. We mentioned the one weakness related that we identified for the audit a few slides back. So I'll move on to some graphs that will just fill you in on the results of operations for fiscal year 2020 compared with the previous 3 years. This slide here shows Winslow's statement of financial position. You can also think of this as Winslow's balance sheet for each year. You'll see off to the far left, Winslow's total assets were just over $288 million at the end of 2020. That was an increase of about $45 million from 2019 to 2020. And as you'll notice over the last 4 years, there's been significant increases in Winslow's assets. Now, in the same time period, Winslow's liabilities have also increased. Liabilities were right at about $5 million in 2017 and 2018, but they really jumped in 2019 and 2020. And the difference between Winslow's assets and its liabilities is reported as net assets. And off to the far right, that's shown on this slide. And because Winslow's assets increased by more than its liabilities in 2020, you see that big increase in Winslow's net assets, which is just at about 167 million at the end of 2020. Now, if you take Winslow's assets and break them down into their most significant assets, they're shown here on this next slide. Cash and investments make up, the overwhelming majority of Winslow's assets at the end of 2019 and 2020, and that amounted to just over $212 million at the end of 2020. The increase from 2018 to 2019 and then in 2020 was really the receipt of the construction funding for construction of the Dilcon Medical Center. And as that project progresses, you'll probably see that cash and investment balance go down and the property and equipment off to the far right start to go up as the activity and the construction of the Dilcon Medical Center progresses. There are also receivables that are mainly made up of client or patient services that Winslow provides and hasn't been paid for yet. And that amounted to about $4.5 million at the end of 2020. Now Winslow's liabilities are shown here on this slide. And really the largest liability of Winslow is called deferred revenue. That's really made up of monies that Winslow has received from its grant programs, but hasn't spent in accordance with those grant programs yet. And that's really made up of the unspent monies received for the Dilcon Medical Center construction project. And like I said, as the cash is spent on that project, you'll also see this deferred revenue go down. So as long as Winslow spends its funds in accordance with the grant requirements, that deferred revenue liability really goes away on its own by spending those funds. There are also payables, which is really what Winslow owes to contractors and vendors for providing goods and services, which amounted to just under 9 million at the end of 2020. And then you have accrued payroll liabilities, which is really what Winslow owes to its employees, both for accrued time as well as for services that they've worked but haven't been paid for yet. Looking at this slide are the total revenues of Winslow for each of the last 4 years, also broken down into the most significant revenue areas. The largest revenue area in 2020 was contracts and grants revenue, which was really because of the increase in contracts and grants expenditures for the Dilcon Medical Center, as well as the COVID-19 funding that was received by Winslow during 2020 that really caused that big increase in revenues from 2019 to 2020. Otherwise, the annual funding agreement expenditures for operations stayed pretty consistent from previous year. Winslow also earns a significant amount of revenue from providing patient services. However, there was a decrease in that patient service revenue in 2020, mainly because of the pandemic and the decrease in patient visits for some of its normal patient activities compared to previous years. Winslow also earns a significant amount of interest income and dividend income. And in 2019 and 2020, with the receipt of that construction funding, which has been invested by Winslow, that interest and dividend income has increased a lot over the last 2 years. Looking at expenses on the next slide, you have your program type expenses, which are expenses that Winslow incurs to provide patient services. And then you have management and general expenses, which is really administrative type expenses, expenses that are incurred by Winslow to, run its business and pay its executives and other type of administrative type costs. And you'll notice that expenses in both of these areas increased from 2019 to 2020 and really have increased over the last several years. Program expenses and management and general expenses really saw an increase because of an increase in salaries and benefits paid to its employees, as well as an increase in operating supplies. A lot of those supplies increased because of COVID-19 and the purchase of PPE and other types of supplies to respond to the pandemic. And then when you take fiscal year 2020 by itself and look at the expenses of Winslow, that's shown here on this slide. And really the vast majority of Winslow's expenses in any year is made up of salaries and benefits. In 2020, that made up roughly 55 to 60% of Winslow's expenses. As you go through the rest of this pie, supplies expense was just under $9 million. Professional fees were $5 million. Purchased and referred care was just over $4.5 million. And as you go through the rest of the pie chart, you can see the other expense areas of Winslow. And like I mentioned on the previous slide, really the biggest change in any of these pieces of the pie were salaries and benefits increasing, and then supplies expenses increasing, mostly because of the pandemic and the effect that it had on Winslow's employees, hazard pay, paid leave time, stuff like that caused some of those increases in salaries. And then when you take Winslow's revenues and reduce it by its expenses, you get Winslow's overall change in net assets. You can also think of this as Winslow's net income or net loss in any given year. And over the last several years, you'll see that Winslow has generated positive change in its net assets or positive income each year. And in 2020, there was a positive increase in net assets of just over $53 million. That is a little misleading because while Winslow did incur expenses for the Dilcon Medical Center expansion or the construction, those expenses get capitalized as an asset by Winslow. And once that project is completed, those expenses will be recorded annually as depreciation expense for that building. So in 2020, Winslow did earn revenue from that project, but the expenses related to it will be deferred until the project is completed. So when you take that out of the mix, the actual change in net assets was about $21 million, which is pretty comparable to the last 3 years.
Sir, may I interrupt just a second? Committee members, do you have the audit report? Was that emailed to you? Ms. Maureen Spencer, go ahead and email the audit report. The annual report had been emailed a couple of days ago. I think this audit report is the one that just now came in.
Well, that's everything from my end that I wanted to present to the HES committee related to Winslow's fiscal year 2020 audit. And if there's any questions you have now, I'd be happy to go through them with you. Otherwise, my contact information is here on this last slide. So thank you again for inviting me to attend your meeting.
Committee members, do you have any questions? Sir, I didn't catch your name.
Yeah, my name is Joshua Trujillo. It's shown here up on this last slide.
Okay, Mr. Trujillo. Of the salaries, what is the fringe benefit percentage?
Let me look that up for you real quick. So, total salaries and benefits were just over $40 million. Almost 32 million of that is pure salaries. And then another 6.5, almost 6.6 million is employee benefits, which is, health insurance, medical insurance, retirement benefits, stuff like that. And that was about 21% of salaries.
Okay, thank you. So in the follow-up question, so in the monies received for the construction of the Dilcon Hospital, the corporation is basically keeping a separate set of books?
So Winslow does track the expenses for the Winslow or for the Dilcon Medical Center within its set of books, but it does identify those activities separately, and it does have a separate bank account which is used to pay for the construction type costs. But it is included in their overall set of books.
Thank you. Show that participating in the committee meeting in the BNF conference room. Committee, do you have any other follow-up questions? Okay. Mr. Virgil Davis, does that conclude the annual report and the audit report?
Yes, it does, Mr. Chair. Unless there are any other questions?
Committee members, any follow-up questions? Just, I guess the main thing is we're participating both by teleconference and Zoom, and it makes it tough for the personable interaction. So a lot of it just kind of like flew by fast. So please understand that, and as we move along, if we have a need for additional questions. Oh yes, Mr. Davis. Regarding the healthcare services, did you possibly get any requests for healthcare from the Winslow facility called Garden of Care, I think is the proper name of that facility, an elderly care home in Winslow?
I'll have Dr. Armeo speak to this. Dr. Armeo?
Yes, we contacted the nursing home. We contacted the campus of care early in the pandemic last spring to see if they needed help, primarily for testing at that point. And we did have we had some staff tested. They were getting, see, the first thing we have to understand is that the campus of care is regulated by the state. Their accreditation, their regulations are from the state. They're a privately owned institution, and they have their own medical staff as well. I think it's a doc and a nurse practitioner. They're not there on site every day, but they have their own. So they have their own medical staff. They're completely autonomous, and we were perfectly willing to help all along the way. And they were doing very well through the entire pandemic, and we kept in touch with them. As you may know, they didn't have a case at all among patients until I think it was November 30th was the first case they'd had in terms of patients. And again, we were in touch with them a few weeks. Well, we were in touch with them all through this. We heard about the case. The case is pretty early on because a lot of those patients end up getting admitted to the local community hospital, Little Colorado Medical Center, where our people are on staff. So there were several people admitted through Little Colorado Medical Center. In terms of the vaccinations, we were, of course, communicating with them in terms of getting their staff and patients vaccinated. But unfortunately, the timing was tragic because we by December 15th, when we got our first shipment of immunizations, they were already in the midst of their terrible breakout over there. So and they were getting vaccines as well, but at that point the vaccinations aren't really going to accomplish anything. They're not an effective acute outbreak control in a in a close living situation like that. So so basically the answer is yes, we were communicating with the Campus of Care. We had offered our help. We were offering help all through the pandemic, and in general they felt, up until things broke out, they felt they were doing very well, and indeed they were. To go that long without any cases was they had a couple of cases among the staff, but they had prevented them from ever spreading to the patients until the very end of November.
Thank you. Committee members, do you have any other questions? Okay, regarding the annual report and the audit report, committee members, could I have a motion and a second?
Motion, Delegate Slater.
Honorable Vice Chair Slater, motions to accept the report?
Second, Halona.
Hey, Halona, you're here. Second by Honorable Pernell Halona. Thank you. Just not us.
Oh, good morning, sir.
Good morning. Follow-up questions, any of the committee members? And thank you. We appreciate Shanala, Ms. Sally P., Mr. Davis, Ms. Scott, Ms. Luke, Mr. Pastakai. And I didn't catch all the other staff's last name, but we appreciate the organization, and we appreciate the high level of health care that you provide to our Navajo relatives and Navajo people. Certainly, the self-governance aspects of providing health care, you set a good example, and we appreciate it. Based on the number of visits to your facility as reported, exemplifies that you do a good, you do provide good health care. And our initial visit back in 2019, we got to see the facilities, and they certainly are first rate. And we are all looking forward to the completion of the Dilcon Hospital, and certainly it's a long-standing need. Thank you. Committee members, if there's no other questions, Ms. Nota, could you give us the roll call, please?
Sherelle, are you on the call? Sherelle,
Do the roll call, please.
I can go ahead and do the roll call. Honorable Paul Begay,
Delegate Paul Begay votes green.
Honorable Paul Begay votes green. Honorable Carl Russell Slater,
Delegate Slater, green.
Honorable Carl Russell Slater votes green. Honorable Pernell Halona,
Will vote green.
Honorable Pernell Halona votes green. Honorable Charlene So,
I vote green.
Honorable Charlene So votes green. Honorable Edison Winika, Honorable Edison Winika,
Say it again. Green.
Mr. Chair.
Ms. Spencer,
Yeah.
Honorable Wanika votes green.
Okay. Mr. Chair, you have 5 in favor, 0 opposed, and 1 not voting, which is the chair. Thank you.
Thank you. Thank you, Ms. Spencer. With that, Ms. Spencer has provided the roll call vote results. Thank you. So now let Ms. Sally P. You run a good organization. We appreciate it. Okay, with that, we'll move on to the item that we added. Let's go first with the update on the Ayananes office space with
Good morning. This is Paula Sinas.
yes, Ms. Sinas, go ahead and provide an update.
Good morning, members of the committee. As I mentioned earlier, my name is Paula Sinas, and I work for Department of Education, Office of Special Ed and Rehabilitation Services. Just to inform the committee, we provide a number of services, very important services to the communities across the Navajo Nation. We provide early intervention services. Those funds come from the Bureau of Indian Education. Those are for children with developmental disabilities. We provide home visitation services to families that have children birth to age 5. We provide services to adults with disabilities in the vocational rehabilitation and independent living programs. And those programs are to assist individuals with disabilities to return to work and to be more independent in their community and home environment. With that, we had an office in the Shiprock community there at the Ayananes building. They're next to the Subway restaurant. And we have had a lease there with Ayananez for some time, providing services. They've moved us around the building because that building is just really not in great shape. Most recently, we're on the west side of the building, occupying space in that area. Around February, January, February, maybe even as far as December of 2020, the landlord allowed Deneb Benali to occupy space adjacent to our office space. They wouldn't really say what the space was being used for. However, our staff began to complain in February about the strong odor of marijuana, and they were complaining about getting headaches and just not being able to work in that environment. The complaints were sent to NOSHA, Mr. Hudson. He was aware of it. I reached out to Alex Kinsella with Department of Justice to look at our lease agreement and to begin negotiating what we can do. I reached out to the President's office, Mr. Bluehouse, and others with the Chief of Staff, and they were aware of our situation, as well as our acting superintendent at that time, Maggie Benali. On March 11th, I did a presentation to Health, Education, and Human Services to seek out assistance in trying to resolve this matter because, again, as a program director for Office of Special and Rehab Services, I was I'm supposed to provide a healthy and safe environment for my staff. With none of this getting resolved, I believe at that meeting, Ms. Kinsella and Environmental Health were requested or required to work together to elevate this issue and to try to find a resolution. Around March 14th, the Navajo Nation government shut down, so we were pretty much out of the building. We've got further complaints in July through Navajo Nation Department of Justice and also with our superintendent's office from Central Consolidated Schools, again, of the close proximity of the fields, the hemp fields that were growing. And again, it was illegal to grow hemp on the Navajo Nation other than a small plot at Nappy. So we were trying to get this resolved. In August, Navajo Nation employees returned to work. The situation had not been resolved. It just expanded and grew throughout the time that we were on administrative leave. When our staff returned to the offices, it was the same situation where, again, this foul odor of the marijuana and the people going in and out of that building, not taking any precautions and safety, as far as wearing masks, social distancing. They were coming in and out of that building. Again, I began to get complaints from staff. Received an email from Ms. Kinsella that there was a hearing scheduled for the 17th of September for a temporary restraining order. And so apparently the legal proceedings were taking place with Department of Justice. So right around then, the fiscal year was starting to begin. There was no resolution from the landlord to work with us, and our lease was ending September 30th of 2020. We started again negotiating with the landlord at Yananez, and it was a recommendation that we find alternate workspace. We seeked office space in the Shiprock community. With none being had, we found office space. We did a quick search for office space, and we looked at several, 3 places that were recommended by Program for Self-Reliance and other programs that have offices in the Farmington community. And we were able to find a location in Farmington, and we're hoping that this is going to be temporary because, again, we want to be in the community. So we negotiated office space in the Farmington community, and so we started processing the new lease. We terminated our lease with Yananez. This was all happening at the beginning of the fiscal year, and just folks returning to the office on a rotational schedule, folks not fully working in their offices. We reached out to facility maintenance to assist in the move because we had to move our furniture and so forth to the community of Farmington. On October 5th and 6th, we were able to seek out a mover after requesting for 3 bids, and we did find someone that was willing to work with the Navajo Nation. Since then, we've been so we're set up in Farmington, so we're out of that building. Since then, we've been trying to, we've processed requests for direct payment for this Pro Relo, which is the moving company. It was returned by Finance. Finance recommended we go through the 6B process, so a purchase order was issued. That was denied again. It was recommended that we go through the 164 process. So we issued a professional service contract. We were well aware that this was after the fact. I submitted justification memorandum to get this moving company paid. I submitted a professional services contract that went through the 164 process. It cleared all departments, including Department of Justice, in the President's office, signed by both parties. Most recently, it went down to Division of Finance. As of yesterday, the vendor still has not been paid. It really concerns me that I get this memorandum from Jeremy Ben, concurred by the controller, that indicates that they cannot process payment with federal funds. I had reached out to the Bureau of Indian Education, Marilyn Holiday, to request approval for payment of these moving costs. She concurs with payment of these moving costs. I'm getting, like I said, denied again for payment for these moving costs, indicating that we are non-compliant with the Navajo Nation procurement requirements, as well as they're citing 2 CFR Uniform Guidance 200.317-326, and again they're saying it's after the fact services. I keep trying to remind Mr. Ben that this was the time when, a lot of payments were delayed, not only this one, and my justification for this payment. I'm really concerned that that as of yesterday, I get this memorandum concurred from the controller indicating that that because I raised the fact that this contract has been signed by the president as well as the vendor, and the vendor has a copy of this contract and wants to be paid for their services. And Mr. Ben indicates that that the professional service contract justification that the president has signed the agreement and therefore must be processed is not true. Section 20 explicitly states that the failure to comply with this provision shall render this contract null and void. So his office is considering this contract null and void. But then on the other hand, he's asking me to look for general funds to pay this professional services contract. So I'm giving you an update that this situation that we had in our office space in Shiprock has still not been resolved. However, we have moved from the Shiprock community. We would like to return to the Shiprock community, hopefully within the next year. I ask for your support for getting this matter addressed, and realize that I have been dealing with this since February of 2020. And again, my whole intention was to provide a safe work environment for staff, and I believe that that should be first and foremost. So thank you for allowing me this update.
Thank you, Ms. Sinez. I know you did highlight this matter originally when the staff had come to you regarding the strong odor of marijuana, and then the aspects of the safety. As you had reported that folks were coming in and out of the particular area that was almost a common interest, both for the employees of Mr. Benali and Navajo Nation staff. So in that regard, committee members, Ms. Sinez is looking for guidance to the situation. We are well aware of the original report by Ms. Sinez, and now they're in a situation of needing to pay bills. By any chance, Ms. Sinez, could we get a memo from Ms. Holliday? I know she's up in the Shiprock Agency BIA offices. And go ahead.
Mr. Chair, members of the committee, yes, I have the email, but I can request a memorandum from her. But we generally communicate through email. They fund our early intervention program based on our child count that we submit. And so, but I can ask for a memorandum from her if you'd like.
Going forward, we may have to get the OOC on the call, Office of Contracts and Grants, and Mr. Paulson Chaco and Mr. Milton Bluehouse, so that we can resolve this. Committee members, Honorable Vice Chair Slater had to exit the meeting. He has been designated to preside over the Nabikiat special meeting, so he's getting ready over in the council chambers to start that meeting. Committee members, in accepting this update, we'll have our wordsmith, Vice Chair Slater. We'll meet with Ms. Sinez and get a better understanding. I guess Ms. Sinez, the other part is that particular contract that we reference, if we could get a copy of that also, so that we have pertinent information. As you relayed, all of this work started before September 30th. This contract to move the office equipment out of Ayananes and to the new offices in Farmington. So in that regard, we'll see how and in every which way to see if we could use the emergency procurement provisions, because we know that everybody was working remotely as well, and then at certain times the financial services offices were also locked down, and even the OOC offices were inclusive of that. So that basically, I guess, gives us a reason to pursue all avenues to get the vendor paid. And I too, as chair of the committee, in my work as a delegate, I had a state appropriation from New Mexico Doltex revert back to the state of New Mexico. So in that aspect, all the justifications that Ms. Sines puts on the table is, it sits in front of the committee and will help as best as we can, and with the ultimate result of getting the vendor paid. Thank you, Ms. Sines. Committee members, chair is open for a motion to accept the update.
Motion to accept update, Delegate Paul Begay.
Yeah, it should say. Motion by Honorable Paul Begay.
Second, Helena.
Second by Honorable Edison Wanika. And third by Honorable Pernell Helena. Any follow-up questions? Okay, if not, then Ms. Sines, thank you for the update, and more than likely, Honorable Slater and I will meet with you in the morning before a council session next week. So we'll proceed in that manner. Ms. Spencer, provide the roll call vote, please.
Okay, Honorable Paul Begay,
Delegate Paul Begay votes green.
Honorable Carl Russell Slater, Honorable Pernell Helena,
Helena votes green.
Honorable Charlene So,
I vote green.
Honorable Charlene So votes green. Honorable Edison Monica. Honorable Edison Winika votes green. With 4 in favor, 0 opposed, and 2 not voting. 1 is the chair, and then Mr. Honorable Carl Russell Slater is excused. So it's 4-0-2 to vote, Mr. Chair.
Thank you, Ms. Spencer. With that, Ms. Spencer puts the vote on this update on the record. Committee members, regarding that third report, the chair will defer it to the next meeting because we do have to be convened at the NABI special session. So that brings us to the last item on our agenda, old business, there being none. 7, new business, there being none. We get to 8, close of meeting. Committee members, any announcements? Alona, are you going to the Arizona State Legislature regarding the Arizona Gaming Compact?
Chair Solana. No, I didn't make it over there. They didn't give me an early enough notice, so.
Do you know when the signing is supposed to happen?
It's supposed to be 10 o'clock. Right now, they're taking care of that.
Oh, okay. All right. No jet plane waiting for you. Just now, hush. Okay, committee members, chair is open for a motion to adjourn.
Motion to adjourn, Helena.
Motion by Helena and a second by Honorable Edison Wanika. Ms. Spencer, roll call vote, please. Motion to adjourn. There is no discussion or debate.
Honorable Paul Begay.
Green.
Honorable Paul Begay votes green. Honorable Pernell Helena.
Rolling West Green.
Honorable Charlene So.
I vote green.
Honorable Charlene So votes green. Honorable Edison Winika.
Green.
Honorable Edison Winika votes green. With a vote of 4 in favor, 0 opposed, 2 not voting, 1 is the chair, and Mr. Honorable Carl Russell Slater is excused. Mr. Chair.
Thank you, Ms. Maureen Spencer. We appreciate your help for today's meeting. So with that, committee members, we are adjourned, and that'll free us up to call into the NABI committee special meeting. Thank you. Our next regular meeting will be the week after council on Wednesday. The next regular meeting will be April 28th, committee members. Unless, of course, you want to meet before that, you know, I'll leave that up to the committee with messages. Okay, thank you. So we are adjourned.